Okay, welcome into a tutorial on how to work up patients within Epic and how to utilize Epic software to be efficient while you're working with your preceptor and while you're in the PCMH clinic. I'm going to go over some of the different tabs that I find helpful for working up patients and where to find information. But as a general overview, there's different ways to find the same type of information within the chart. And so I just want you to be aware of that what I may show you today may differ from how your preceptor accesses the information. And just know that there's not one right way to do this. But this is the way that I found to be most helpful for my own practice and how I've taught some of our students in clinic. But just want to provide that initial caveat before we get going. But to give you an overview of kind of where we're going today, I'm going to talk about some of the different components to the workspace that may be helpful for you to find information. And so when you're looking at a patient's chart, you may have accessed their chart by going to the chart button at the top, searching their name and any identifiers that may be helpful in finding their name, and then clicking on their name. That pulls open their chart. So if I click on this patient, they are opened up in this chart. And this is our testing environment, so this isn't a real patient. But once you click into a patient, you're going to get the snapshot tab. The snapshot tab is a nice little overview of everything that's going on with the patient at a 30,000 foot view. So you've got the patient's name, date of birth, address, you've got their problem list, so some of the diagnoses that may have been associated with care over the course of several years, or possibly in the acute setting in the hospital. You get a snapshot of their social history, like tobacco use, surgical use, or history, family history. You get a look at their medication allergies or other types of allergies, and then medications. And so lots of cool pieces of information here. And you can always click on these tabs and get more information. So within this tab, you're seeing additional information on the medications. It jumped you into the medications tab at the top here. So snapshot view is a nice place to start if you're just trying to get a general overview of the patient. On the far left-hand side, you're also going to get some nice components of an overview for the patient as well. You'll have their sex, their age, their date of birth, and if you hover over that information, it's going to provide a lot of other demographic information. You can also hover over who their primary care doctor is or who they may be associated with from a care team perspective. You can hover over their insurance plan to see what type of insurance they may have. And you can also click on this to get more information. Again, within benefits and query tab, get more information on their insurance information, their ID numbers, and those types of things. And then allergies, some vital information. And if you hover, you're going to get a spreadsheet of those vitals for at least the last 3 values. And then you're going to see care gaps as well. And care gaps are something that I think a lot of our team uses to identify what type of labs might need to be drawn for patients, what type of vaccines they may need to get, or to help to set our PCPs up for success and help to educate them or notify them of different things that the patient may need that we may not be responsible as the pharmacy team. So just a few things to think about on that level. I'm going to now click into the chart review tab. The chart review tab think is where you'll spend a lot of your workup time. So once you've taken a look at the snapshot, I encourage you to click into the chart review and to take a look at some of the patient's notes, right? We need to get an idea over the course of maybe 1 to 3 months as to what has happened with the patient in the past. It may be that you're following up with them every single week, and so you know a lot about them, and you're going to have several notes over the past couple months. It may be your first time seeing a patient, and if that's the case, you're going to want to really take a look at all their notes over the past 3 to 6 months and get an idea of why they're coming in to see you, where they're at with their care, what's happening with their medications, all that type of stuff. So if I click into today's visit as an encounter, it's going to show me any notes that have been made within that encounter. So I don't see any notes here. So that means that the patient's visit is currently open. You can see that designated here, and that whoever is running this visit hasn't completed their note. So it looks like it's Dr. Quinn. So Dr. Quinn hasn't necessarily completed their note for this visit yet, which is completely okay. Once they do sign that note, their note will pop up into this tab. But if we go to a different office visit, one that happened in the past, we can actually take a look at the note that did occur from Dr. Quinn on March 6th. So we take a look back here, and we can review their notes. The other nice part of the encounters tab is that if a nurse put in a note or if a pharmacist put in a note based off of that same visit, all of those notes are going to populate within the encounter. So you can scroll through and see the different things that happened within one encounter, whether it's an office visit or a hospitalization or something else. If you want to get the notes separated out specifically, you would click on the notes tab up here, and this separates all of the different tabs within the encounter into its own clickable format. So Dr. Quinn's note is here from the original encounter that we had. If there was a nursing note or a nursing visit that happened in association with that same office visit and the nurse documented something there would also be a separate note tab here for that nurse visit. This one happened yesterday. This is a separate nurse visit, but you can see this is the note for that. So you're going to get the same information as far as notes are concerned within encounters or notes. The nice part about notes is that it just separates them all out if you're looking for a specific provider. Okay, so that's the encounters tab. I encourage you to look into whether it's the encounters or the notes tab to review what has happened with the patient, see what type of plans have occurred with the patient over the course of the last 3 months so that you can build off of that for your visit with the patient or your conversation with the patient. I'm also going to click into the labs tab here right next to the encounters tab. This is going to be separated lab values that you can take a look at. So this is the patient's A1C that was done 4 days ago. It also gives you a few values of historical data that you can compare their most recent result to if there is any historical data there. So we can click back and see, okay, they got an A1C on March 6th. They got one on January 20th. They got a CMP on December 31st, and you can compare their CMP results to when they were drawn 10 months ago as well. So I think the lab tab here is a really nice tab to get a clean view of the patient's lab. If you're looking for more trended results, you might click into review flow sheets at the top here in one of the main tabs. This review flow sheets can give you an idea of a patient's vitals over the course of time. And it can give you a nice screenshot of many different data points over the course of time. So here we have 6 different separate days of vitals. If you're looking for specific lab draws outside of just vitals, you can also take a look at those within your results review tab. The results review tab allows you to click into a specific type of lab draw and see those values trended out over time. So it's similar data, again, to what you're going to get in the labs tab. It just trends it out into more of a table format, which can be helpful if you're looking at maybe what their A1C was 5 years ago and how that's trended over time and the different interventions that were made over the course of time. So that's the lab tab. That can be helpful. We don't often use the path tab as much. The micro tab you might utilize if you're helping to treat or determine treatment for a UTI or other sort of infectious disease components. We don't often use that tab. Imaging tab, you're probably not going to use a whole lot either, but it's available if the patient's gotten any imaging. Historical procedures will be there. ECGs can be located in the cards or ECG format. Here, you may be taking a look at this for a patient with heart failure or other sorts of cardiac conditions. The meds tab is something that you'll definitely utilize and look at. Again, this tab is a little bit more of a cleaner medication view. It doesn't give you a ton of details right off the bat, but if you single click into these medications, it's going to give you the details to the right-hand side. And so you can take a look and see, okay, metformin 500, how many refills were sent, the quantity, and I often use this screen to figure out what pharmacy the medication was sent to, and if I need to call the pharmacy, their pharmacy contact is there as well. So that can be helpful. You'll also see any sorts of like continuous glucose monitors or glucometers available that the patient might be using in the meds tab. DME will also populate in the meds tab at times. So you may find things outside of just strict medications as well. Here they've got some glucose blood testing strips that looks like that was sent over in April of last year. So again, you can single click into the and get this information to the right hand side, which is nice. Episodes is something that you might utilize depending on your preceptor. oftentimes we're keeping track of this and linking our encounters into a specific pharmacist episode. And so if this is a part of your preceptor's workflow for you as a student, you should ask them about this. This allows us to take a look at essentially all of the encounters that we've had for a specific patient for a disease that we were referred for. So if we were referred to follow a patient for diabetes, we would have a pharmacist diabetes encounter, and then we could pull up all the notes and any of the timeline components of the patient while we were following them during that time. It also helps us to track data. So the episodes tab is important from a tracking perspective as to the care that we provide our patients. I would encourage you to ask your pharmacist preceptor as to how they would like you to link episodes and if that's a responsibility that they have for you as a student. Other things that you might see are different letters that a physician or nursing team has put together for a patient. Referrals, you would see a pharmacy referral here most of the time for patients that we're seeing. So a referral would be placed from a physician for diabetes or for hypertension or for anticoagulation. And that essentially gives us the green light to follow the patient over time and follow our CPA and make medication recommendations and adjustments for the patient. So that's the tab there. And then over on the top hand side are kind of main tabs. You're going to see a lot of different components of what you saw in the snapshot, just in more detail. So you can go into the problem list here. You can click into the medications in more of a tabular format here. You can take a look at the patient's history of immunizations in the immunizations tab. So all of those things can be helpful for you in reviewing a patient's chart. And you can kind of click around. Again, if you click in the snapshot tab and you click any of these specific tabs, it's going to pull up that information in more detail. So this is me clicking into the tobacco history tab. Now you've got a lot of information that you could put in for a patient who might be a current smoker or a past smoker, and making sure that it's accurate here. You're just going to get more detail once you click into those specific tabs from the snapshot. So again, I think that can help you work up a patient. You want to be as detailed as you can to ensure that you're getting all the information possible to have an appropriate conversation with the patient, especially if you haven't met them previously. I definitely encourage our students to take a look at the past 1 to 3 months to make sure that they have an idea of what's happened most recently. But it may even be warranted to go back 6 months to a year, depending on the different types of treatment or the different progression of their disease states. So I think that is what I wanted to cover as far as workup is concerned. When I think about some of the buttons to click as far as creating an encounter and talking to a patient, there's different ways that you may go about that. If you're seeing a patient for a telephone visit or you're going to give them a call, you might be clicking the encounter button, which the encounter button is likely going to be available for you without having to tag it in. But if you do need to pin the encounter button, you just click the pin button here, say add to my toolbar, and it's going to show up in your top right corner. Same thing with telephone call. And you might want Sync Health or PDMP as well. So if you click on encounter and you click on the patient that you want to create an encounter on, you can say create an encounter. You can type in, hey, I'm going to make a telephone call for this patient. You would put your preceptor's name in this provider tab and then click accept. And this is going to pull up an encounter. So now we have a new encounter for this patient. And this encounter then allows us to document all the things that we do for a patient, any of the adjustments that we make, any of the outreaches that we have. And a cool part of what we've done over the course of the last couple of years, and when I say we, I can't take a ton of credit for it, but Dr. Donovan and the PCMH team has put together this AMB-RX tab. And so everything that you really need for an encounter as far as the information you should be collecting or documenting is within this AMB-RX tab. So if I want to document that I made a phone call, I can click the associated buttons to make the phone call. If I want to document a reason for a call, I can say I'm calling them for diabetes. And say, okay, close it out there. Now I have a diabetes reason for call. I talked about episodes. We can link our episode there if they had an active episode available, which means that we're essentially having another notch within that encounter that we can look back on. If you need to make any medication adjustments, you can do that within the medications tab here. You can take a look at some of their diagnoses, the care team. We often put ourselves on the care team if we're following a patient for an extended period of time. And so the care team is something to make sure that you're a part of, or your pharmacist preceptor is a part of, so that you can get the lab values associated with that patient over time. And then progress notes. So on your right-hand side, you'll often have an auto-populated note, meaning that the documentation screen pops up automatically. But if you don't, you can say create note on the progress notes tab here. It'll pull it up on the right-hand side, and then you can work on your documentation here. And your preceptor will likely have smart phrases for you to document. So I don't know if my smart phrases yet. My smart phrases don't populate in the playground, but if you had a smart phrase, you can click that smart phrase and it will populate here. And this is just one of the templated smart phrases from the playground, but there will be 3 stars, which means these are wild cards that you would populate in your note. And your preceptor will likely have specific note templates that they want you to use for your own documentation purposes. So ask them about what smart phrases they want you to use in clinic. The other pieces within this AMRX tab are CGM assessment, smart forms that can pull into your note as necessary. You can work through that with your pharmacist preceptors, as well as any additional medication details that you might be printing out for a patient via AVS or after visit summary, or any patient instructions that you're going to print out for the patient or have available for them, things that you may have talked about from a lifestyle counseling perspective or a medication adherence perspective that don't normally print or populate without some sort of free form typed response. So you can use patient instructions tab. That's often used when we have in-person visits because we can give them something a little bit more hard copy. And then you can route your note to your pharmacist preceptor for them to see within their inbox, or you can route it to the physician to let them know of the different changes that you made, so they're aware of the different changes that were made in a phone call or in a visit, so that they can be prepared for the next time that they see the patient and provide any additional input and just see that our pharmacy team is working with some of their patients. So once you've done all the documentation that's necessary within this encounter, you would click accept, and then you would have a sign encounter button at the bottom right, but your preceptor will be the one signing off on the encounters as they need to sign off on your notes and be aware of the different things you're doing as a student. So I think that is a kind of quick and dirty component of phone calls and or encounters. If you are double clicking into your schedule, I'm not going to have anybody on my schedule due to the playground, but your patient would show up in your actual schedule calendar here in the top left corner. And you could double click. If your patient showed up to a visit, you would double click into that calendar patient visit, and then it would pull up in one chart in clinic visit, essentially. So it would pull up these tabs that you would be able to click into and start to document on for in clinic visits. And so it's going to show a little bit of different formatting for phone calls versus for in-clinic visits, or maybe for other types of encounters like our anti-coag encounters. But by and large, you're going to be able to access or get to the same type of fields or the same type of documentation windows that you normally would for any sort of visit. You just have to figure out how to get there depending on the encounter that you're opening. So hopefully that's clear. And a piece of it is you just have to go through it a couple times to understand what I'm saying. And then the final piece that I'll mention is our anti-coag encounter. So you're going to be seeing a lot of patients for warfarin management and INR follow-up. These anti-coag encounters, if you don't have your anti-coag button, make sure to pull that in from your Epic menu on the top left. But these anti-coag encounters have some specific tabs themselves that you're not going to see in a telephone counter or an in-person encounter. So this anticoagulation tab here is something specific to the anti-encounter, and it allows you to document the patient findings that you ask a patient about, your classic bleeding, bruising, medication changes, missed doses, new medications, all those types of things that you would be asking about for a patient on warfarin. And then this anti-coag track window is also important. We don't have an episode open for Felipe cotton candy, so I can't show you the exact window here, but talk to your preceptor about that anticoagulation tracking window. That's probably the most important window of this entire encounter. And it allows you to track the patient's weekly doses. It allows you to track any changes that you're making and those types of things. And then on the right-hand side, again, all of that information that you've documented or clicked buttons on, whether it's the plus sign meaning it's positive or the minus sign means negative, or clicking otherwise negative and turning them all negative, meaning everything's going okay with the patient, no new changes. All of that information is going to pull into your smart phrase that we use for a PCMH team. And so if you do the right type of documentation within the patient findings tab and the anti-coag track tab, then most of the work is going to be done for you within our smart phrase in our note template. You'll just have an assessment to make and any other findings that you want to add within the subjective side of the note. So that's really helpful. So make sure that you know where to click and how to document within these different tabs so that you do yourself a service when you're pulling in your note for the anti-coag side. Talk to your preceptor about those. Again, once you run through it a couple times, you'll get the hang of it. And it's kind of like riding a bike. After you've done it a few times, you'll understand how to go forward. But hopefully this gives you a little bit of a head start. The last thing that I'll mention is our open encounters and or in basket. So the in basket looks like your email in basket almost. If you're sending messages, you can send messages back and forth with your preceptor or with other team members. You can click new message at the top here and send a message to your preceptors. So if you type in their last name, it'll pull it in there. And then it will allow you to send a note to anybody that you need to notify them about a specific patient. Or you can delay sending messages and remind yourself in a week or 2 weeks or whatever it may be to follow up with the patient, whether it's over the phone or in a different type of way, maybe a one chart message. So you can delay sending these messages for a specific date, and then the message will populate into your in basket on that specific date, but it won't populate until the date that you've specified. So that's kind of helpful if you need to give yourself reminders for the next day or for the next week, or however your specific preceptor likes to do follow up. So that's a way to send messages. All of your messages will populate within this tab up here. Your preceptor might also forward you different charts that they want you to call for. So they may have opened an encounter already and want you to call a patient. And if they forward you a chart, those charts are going to end up in your My Messages queue in your in basket, which can be helpful to know. So you can click into your in basket, find the encounter that your preceptor routed you, and then you can click into that encounter and start your encounter right away instead of having to make the encounter yourself. And sometimes that just happens when you're seeing multiple patients in a given day and your preceptor needs to triage a patient to you, or you need to triage a patient to your preceptor. You can do that via routing and the in basket. So know where your in basket is in the top left-hand side, and then talk to your preceptor about how they handle follow-up and how they handle communication within one chart so that you follow kind of their own methods, but that's where the in basket is located. Okay, so I know that was a little bit of a speed run and working up a patient and taking a look at the different buttons you can click within Epic. Hopefully you found it helpful. Hopefully it gives you a little bit of leverage as you walk into your first couple days in clinic. Again, a lot of this information can be found clicking different types of buttons, but getting the same type of information. So your preceptor may have different ways to do that. Be sure to ask questions, especially in this first week, to ensure that you're following what they would like you to do, not what myself or others that you worked with in a PCMH setting have done, just because everybody has a little bit of a unique process, even though most of it's standardized. So, all right. Hope that's helpful. Have a great rotation.